Hello everyone and welcome back to the channel. Today we're going to be talking about by far the most common skin cancer. This can also be known as a rodent ulcer. My name is Dhalia Masud and I'm a plastic and reconstructive surgeon, and today we're going to be diving into basal cell carcinoma, or a BCC, and I'll tell you exactly why they call them a rodent ulcer. Don't worry, it's not as scary as it sounds, but it's something that you should know about. A basal cell carcinoma is sometimes nicknamed a rodent ulcer because of the way it looks and behaves when left untreated. The appearance is that it slowly enlarges and it often ulcerates, so that's an open sore in the middle, and the edges remained raised and rolled, and this gives out a gnawed out look as if a rodent has chewed into the skin. It's a slow destruction of rodent nibbling into it, and that's why it's called a rodent ulcer. It's not a scientific term, it's more of a descriptive term. So what is a BCC? A BCC is far and away the most common skin cancer, making up to 80% of all the skin cancers in the UK. The incidence is slowly rising, likely due to the enhanced detection, ageing population, and the cumulative sun exposure. So when we look at the microscope, what does it look like? They grow from the bottom layer of the skin, or the basal layer of the skin, and sun exposure, and particularly people with fair skin can develop these lesions. Although we're more conscious of taking care of our skin and protecting it from the sun, in the past that wasn't quite so. I have heard stories of people sunbathing with oil in their youth, and now unfortunately we are seeing the effect. So why do we consider it as a cancer? The reason why we consider it malignant or a cancer is because it destroys the local tissue, albeit very slowly. So it's slow growing, and although it rarely spreads, there is that potential if you leave it for many years. So it can be problematic, but very treatable if caught early. So what's the pattern? So how can you tell if you have a basal cell carcinoma? They are variable in the way they look. They can appear as a small red patch to a raised lumpy lesion. They can sometimes have a colour, and as I've already said, they can ulcerate or have a sore in the centre. This can be very difficult for people who aren't experienced to say whether something is a basal cell carcinoma. That's why it's important to get your lesion checked out, and the doctor will look at it either under a dermatoscope, and if they themselves are unsure, they may send a small biopsy to confirm the diagnosis. But one pattern that patients do describe is the long, slow-growing effect of the lesion, where it ulcerates, it might weep a little bit, it heals and you think it's gone, and then it reappears. And this kind of happens in a 6 to 8 week cycle and can go on for many months before it starts to grow and you decide to go and see a doctor. They commonly occur in sun-exposed areas such as the nose, the eyelids and the cheek, the top of the ears, and these are the areas which are most noticeable. How do we treat these lesions? When they involve the face, particularly near the eyes, the ears and the mouth, it's important to pick these lesions up early. The good news is that BCCs are highly treatable. The choice of treatment depends on the type, size and location. So what are the different options? If they are fairly small and we've caught them early and they are flat, our treatment options may be cryotherapy, and that involves freezing the area. We may need to bring you back and have an assessment to make sure the lesion has gone, and if it hasn't, you may need a second cryotherapy session to completely remove it. The other option is using a topical cream called imiquinod or 5-fluorouracil, and you'll need to apply this regularly over a few week period, and during this process the lesion will ulcerate, create a scab and then fall off, and then you'll be assessed by the doctor to ensure that it's treated. If the lesion is larger and cannot be treated with freezing, we may need to remove this surgically. So let's keep it simple. If it's superficial and it's small and we've caught it early, we can use creams and cryotherapy. If it is lumpy, large, and it covers a larger area, we may choose to remove this surgically. And when we remove it surgically, we don't just take out the lesion, we take out a cup of normal tissue. Another option of surgery includes Mohs. And Mohs is a technique where it allows us to check that all the cells are completely removed before we close the skin up. So when we choose to do surgery, how do we close the area? This depends on a number of factors, the location and how loose your skin is. Now we may choose to close it directly or do a form of reconstruction using a graft or a flap. Now I'm not going to go into this today. In subsequent videos we'll talk about how these reconstructions work and what to expect exactly. So if you subscribe to our channel, we'll be able to update you on the information on full thickness skin grafts as well as local flaps. The key to BCC is prevention. Now because it's due to a cumulative sun exposure in the past, if you have one, it's likely that you may develop others. So it's important to prevent further basal cell skin cancers developing by ensuring that you use SPF factor regularly, a minimum of SPF 30. Avoid the midday heat. And if you are gardening a lot, make sure you wear a hat and long sleeve clothes to protect your arms and your face from the sun. So to sum it up, a basal cell carcinoma is the most common skin cancer. It's slowly growing, rarely spreads, and can destroy the local tissue if left untreated. The good news is, catch it early, it's easily treatable with excellent results. Now, if you found this helpful, don't forget to this video, subscribe to the channel and share it with someone who might benefit. And as always, drop your questions in the comments below and I'd love to hear from you. See you in the next video. Bye.